I'm requesting as a disabled person I would like a hospital advocate to come talk to me, please. I'm requesting that you call and ask for one, please.
I don't know who you want to talk to.
I would like to have a hospital advocate to come talk to me.
Call the medical records and then have somebody come talk to you.
Ma'am, is there an advocate around here? I need a patient advocate. I'm a disabled person. I'm requesting an advocate to come help me. I was in the hospital about a week ago, and I'm having to go back to Alabama with my records. I came in yesterday, but I had to walk in here. It takes a lot because I have 3 separated vertebrae,
Okay.
T1, T2, and T3. And it took a lot to come in here.
My husband's a quadriplegic, I feel you.
So I'm asking for a patient advocate to come talk to me to kind of facilitate what I need to get my records or whatever. And I'll sit right here. I really need somebody to help me as a disabled person.
Okay. Did you call anybody at administration?
They said it wasn't their job
You
duty.
need to call medical records and talk to them.
But I'm a disabled person. I'm requesting accommodation.
You have a phone, you can call medical records.
And I'm requesting
It's a
accommodation.
violation for us to do that.
It is the law, the ADA law. I don't know why I'm being treated like this.
Give me 1 second. I have to check something else for another patient, and I will talk to...
I'm just requesting an advocate,
I
please.
understand. I understand exactly what you're saying.
Thank you. Be still, baby. We'll be ready to go in a little bit.
I just found out for you, medical records is closed because of the COVID-19.
Mm-hmm.
This is their, they didn't put the area code. I'll put the area code up on top. Okay, the area code's 904. That's their direct number.
Mm-hmm.
I don't know how their answering machine, but they
It's
would,
all right. I have a nurse get me a patient advocate. It's okay. Thank
yeah,
you very
okay.
much.
Well, I'm telling you, again, they're closed. There's really nothing they're
I
going to be able
understand,
to
but
do.
they can get the records. They can pull them another way.
Oh, if they, I don't know if they could. Good for them, because I don't know that they're.
Some way, somehow, I have to have my records. I have to have medical care quickly. Y'all have no idea what kind of shape I'm in.
Yeah, I'm with her right now. Well, I just spoke to Diana in Human Resources, and she gave me the regular phone number. They're closed. She would have to call them, have a HIPAA release form sent to her. She'd sign it, and then they'd send her the records. That's what was told to me. Yeah, and then that's all. Right, I got you. All right. Right, right. Okay. Okay, thanks. Just what I told you, they said that's what you're
I'm
gonna
gonna
do.
sit here until somebody comes and helps me, cause I gotta go back to Alabama and get some medical care.
Okay, I understand that. There's only so much people can do. They can't break laws. I don't know.
It's not the laws, this is
It
an.
is the law.
No, it's not, I have a right to my medical records.
You
for
do,
care.
but through medical records, nobody else has the right to access them right
I
now.
will sit here until somebody
Okay,
comes
well,
here and helps me.
Okay, well, then you might be sitting here for 3 days.
Okay, that's fine, I will sit here for 3 days.
Okay, what, huh? No. Might, well, maybe. I don't know.
I wanna talk to a nursing supervisor, please. I'm requesting a nursing supervisor.
Well, cool, nurse supervisor, they wanna come and talk, or that's fine. Not much they can do either, but 4, 5, 4, 3 is. No, that's, you wanna go up here, 4, 5, 4, 3. It goes to a voicemail, hang up and dial it back, so we can pick it up. No, they carry the phone.
These are mine.
Nice.
Waiting on with y'all. My registrator is looking up a number for you to call within the hospital to talk to somebody to see if they will
I'm
be
not
able
gonna, just,
I gave her
ma'am,
her
please.
number. I gave her
I
her
can't
number.
call him, I want somebody to come facilitate this for me, I can't do it. When I say I'm disabled, you can see it here, I can't write. I have a hard time looking at a computer, I can't move my head. I have severe limitations even though nobody thinks I do, I don't look it. And right now, my brainstem is swollen, and I'm having some issues with some memory loss right now. So the thing is, I need someone to come talk to me and help me facilitate. I'm requesting somebody to help me right now.
Well, that's why she's giving you the number to directly talk to someone who's here now who can send someone down to
But
talk to you.
y'all need to call this person for me,
Medical record
please.
is closed.
Is it?
Yes, it is.
Well,
Well,
she has another number to call. She's looking it up. She's doing with a patient right now. She said if you can give her a minute, but that's, I mean, I
then
don't,
please ask her to come talk to me, because as a 38-year nurse that ran hospitals, and especially people who needed records in overtime or was a house supervisor, which I was a house supervisor, I retired VA, state, local, and private hospitals. And compliance and ADA right now,
I can help you.
I can tell you.
trust me, I completely understand.
Yeah,
My
I can
husband
tell
is
you
a
that you
wounded
can pull
warrior.
records
Oh,
out,
the-
because I also
for-
need
for
a
COVID?
disc of my MRI in my
Yeah,
neck to take back to Alabama, so I can have some care.
I totally understand.
Okay,
where
I'm
you're
not trying to be
coming from.
ugly, I'm just saying.
No, I know, I understand. My husband is a quadriplegic. He was injured in his service in the military. I've dealt with everything from
And I
underneath the
took
sun
care
when
of
it
veterans
comes
like
to
that.
the VA and everything, getting things done. So I understand where you're coming from and the frustration about the disability. I do understand that. but I'm just a surgical tech, I'm normally not out here, so I'm trying to help you as
Thank you.
best that I can, cause
Thank
I
you.
understand where you're
Well,
coming
all
from.
I'm I can't call anybody because I have a problem with doing that. I need somebody to facilitate that, please. To come talk to me and facilitate it, because I'm telling you, as far as calling numbers and doing all that stuff, I can't do it right now. I'm having a hard time.
Well, let me go do what I need to do here, and then I'll come back to registration and see if she's
Thank you.
able to come and
Thank you.
talk to you.
I have everything I need to see of my disability.
I know, she's got more powers than I do down there, so she might know another avenue.
Nursing supervisor too. We can only do so much. We have done what they told us to do, which is to give her that number, but the records is closed. They won't even have until tomorrow. So we can't go get records, we can't bring them to her because.
I understand that, and I know that, and I know your hands are tied in a lot of situations, but she's got, like I said, she's got some sort of insight that we don't have.
And I hope she can, because I try to be as cooperative as I can, and
All I have to do is sign a release, a HIPAA release. They can pull up the records out of the computer and give me and go to X-ray and get me a copy of my MRI, and that's all they have to do. It's very easy. Take 10 minutes.
It's not just about.
I'll be back.
We're still waiting for the finish his cigarette. I'm serious, he's smoking a cigarette.
And the longer I see them, the more my pain is getting, is climbing. So, I'm in a lot of
we're
pain.
doing the best that we can.
I understand.
I've just called 6 times the nursing supervisor, and nobody's answering. And she's the one that will make decisions over this person that she's talking to and everything. She is, at this time of night, she is God. She makes all the decisions.
Okay, well, I want to speak to God then,
Well,
please.
that's what I'm trying to do, is I'm trying to get a hold of her for you.
Okay, thank you. Thank you. I know this hospital does not run itself without supervisors.
Now you got
Okay, you have a good day.
it. Yeah, you too.
I'll call them.
No, not the supervisor. Supervisor's 077.
Well, page them. Please.
It's not the way this hospital works, man.
Okay.
Each hospital has different rules. You know, you don't run this one.
No, I don't, but never mind. I'm gonna let y'all sit here and do your little game, and it is what it is. I'll sit here. Because I know what the laws are.
We're not doing any game, we're doing the best we can to help you out, man. You're making it harder for us to try to help you.
Could you come down to the emergency room, because we have to hear what kind of situation? Excuse me? Yeah, no, the inside, the inside desk here, the officer, Norris is at the desk. Thank you. Okay, thanks, bye.
No, they can't, but
Gee,
you're looking
You
for medical
call them and
records?
see how they can.
I got the nursing supervisor.
Okay,
I
she can
need
call
somebody to
medical
help me.
records.
Ma'am, I'm
Records are closed.
I gave her the number,
Uh-huh.
I'm trying to explain to her, medical records is closed.
Mhm.
She has to call them, eventually get through, they'll send her a HIPAA release form, she'll sign it, she'll send it back to them through fax or email, however you do it.
I'm requesting accommodation as an ADA. I'm disabled. I need to go back for medical care. I have a disability even using the phone right now because the swelling on the back of my brain is really bad on my brainstem. I came in here, it was hard to come in here. I came in here yesterday afternoon and then I came back today. It's a hardship. What I need is somebody to come and just help facilitate this. I just need somebody's time.
Oh, okay.
That's all I ask for.
Nursing supervisor.
Thank you so much.
Y'all didn't see that, by the way.
No.
What?
Me switching out the cartridges.
Just seeing why it's changing.
Second floor, so the metal glass. Thank you. How you doing? My name is Sean Glass.
I could be
down
careful.
in the emergency department, and I called earlier about getting the Melvin glasses, personal thing. Is it? Okay. How you doing, Joy? This is Sean Glass. From all over, okay. I'm downstairs in the emergency department, and I called earlier about picking up Melvin's personal things. I needed a few things from him to just handle some business for him. Yeah, my Uncle Jerry. Okay. Okay then. Okay, that'll work. That'll work too.
They want me to get paperwork out of the car on me right now. Thank you.
Well,
Where's the soil linen drop?
go right through that hallway there toward the back there, you see the little.
It's okay, she's doing her job.
I didn't recognize that.
She's a PTSD dog. She's supposed to alert me when people get too close.
Okay.
But she will bite, so I have to make sure that she's contained. She's very protective.
I was expecting it.
Well, she's very protective.
I don't blame her.
She knows how to behave, and she's supposed to alert me when people get too close.
Do you want the mom to sit out here in case they wanna talk to her? I will tell her. Maybe just for a few minutes. Okay.
Moving up positions. They did it at Howard. I worked there 12 years. They got a guy, he's only been there 3 months.
Hello.
What's up?
We have, a woman here is looking to get her medical records.
May I speak, please? Because y'all have really screwed this one up, please.
Sure, go ahead, ma'am.
Ma'am, may I speak to you, please?
Sure.
My name's Kimberly Parker. I was in here a week ago, or about a week and a half ago. I am disabled. I have issues right now with my tolerance, due to the swelling on the back of my brainstem right now, due to a C1 all the way to T3, has been disrupted right now. I'm having issues with speaking on the phone, just anything to do. So I came in here yesterday afternoon and asked for my records. About 4:30, they said they were closed. So I came. They asked me to come back today. It took me to this time to get here because it took me 2 hours to get ready. Finally got here. Finally got in here and sat down and requested accommodation for someone to come talk to me. All I need is my records, and I need a disc from my MRI that was done so I can go back to Alabama and get some medical care because I'm in need, and that's all I needed. And I can't go I can't go all over the place. I just need to sit here and let somebody get this for me and come back with it. And I know it can be pulled out of the computer, and I know somebody can go to X-ray and get the MRI. Only take a few minutes. And I'm just requesting that, please, as an ADA.
Yeah, did you call medical records today?
No, ma'am. I'm telling you, I can't do all that right now. I can't even hardly use a phone because of my limitations. I've got documentation of my disability. I'm requesting somebody just to facilitate this for a few minutes and give me my records. I'll sign a HIPAA and I will be out the door.
Let me call medical records.
Thank you.
Why are they closed? Because of the COVID. I just spoke to Diane in Human Resources. They're closed. I gave her the number. She'd have to get in contact with them. She was told they would send her via like email or whatever a HIPAA release order.
Right.
And then they send them to her directly, but
Right.
she doesn't accept that, and she wanted to speak to you.
So they're closed.
They're closed, yes.
Oh.
Well, then somebody needs to just go in there, pull everything out of the computer and get a copy of my disc. I'll sign the HIPAA. Yes, you can. You can. I need my records, please. Somebody can facilitate that. As long as I sign a HIPAA, they can give me my records. It doesn't have to be medical records giving it to me.
I disagree, but you know, that's if you can find somebody to do it, fine, but.
We can't do that.
Why can't you do that?
Because that medical records is a specialty area. They're the ones that have to do all the paperwork and the improvement.
All you have to do is go in and pull the records out, because y'all can do that as a nursing supervisor. You can ask X-ray to give me a copy of my disc. I will sign a HIPAA and I'll walk out the door. That's what I'm asking you to do,
Okay,
please.
all right. Well, let me just, talk to somebody.
You're denying an ADA person accommodation for my records, and I'm in need of them now. Not tomorrow or next week when they decide to send them to me. I have to make a decision of what I need to do right now.
I understand that. There's certain things that are beyond our control.
Nothing is beyond your control. This is very easy to do.
Why this thing does this, that hoses in by the shed. And that's the only thing there. There's no super in it. Just screen off.
I'm gonna have to go back upstairs. Oh, that's all right. I have to go back upstairs.
Thank you. Thank you very
I
much.
have to talk to somebody, but,
It's always a thing.
and then I'll either come down or.
Thank you very much.
Okay.
Did you do that? You pulled it right out and broke it? No, but somebody thought it did because they pulled it all the way out till it broke. That's the joke. So that's the joke. So it's
She just, when,
You're attack doggy.
well, when people get too close, she's a PTSD dog.
Ah.
She alerts me when people get too close.
My dog
I
does
just
that
hear a
too.
little pop.
Yeah, she alerts people when they come up behind me or something, so I don't get startled.
What kind?
She's a little 5-pound Yorkie, but she has to be contained because she's a little vicious. They think they're bigger than they are.
Yeah, they are.
But she's a very good protector. I mean, anybody that comes up to me, she alerts me so I don't get startled and get real nervous because I have PTSD. Yeah.
Okay. Well, that is wonderful. I've got a shelter rescue dog, and it's part Yorkie. But they're good. Those terriers are good protectors.
Yeah, she's been with me the whole time, 4 years, so she knows exactly what I need.
Good. Good. Take care.
Thank you.
Hey. Okay, sounds good. Bye.
Probably.
I haven't seen many of them.
You having a good day?
It's been fun. That's for sure.
Mm.
Yeah, I rescued my little doggy, and she does the same thing. She will just, as soon as she's always, when you're walking her, no matter what, no matter where she's at, she will always just, and she'll see people, everything before I do. Like, she is just constantly on, kind of like that, just constantly watching, and if somebody gets too close to us, forget it.
The little dogs are worse about it, I think, than the big ones are. So she nailed somebody the other day that got too close to me. And I warn people, and they think, oh, she's cute, and then boy,
Yeah.
she nailed them.
Mine's got a little lab mix in her.
Mm-hmm.
So she looks cute too. She's got little floppy ears and everything, but yeah, she'll bite you if you get too close to her. Hey.
They'll say, well, she's not a service dog. She can't do anything. It's like, yeah, she does. She barks and she lets me know because if you ever dealt with people with PTSD, especially veterans, when people walk up behind you or get too close, if it startles you so bad that it just, you end up, I've been startled so bad at times and people didn't mean to. They just walked up and touched me or something, and I end up
You can go into panic attack.
going to a panic attack. Yeah.
Absolutely. Yep. Probably about 50% of us in law enforcement have the same issues. Just
Well, the thing with her is being ADA, people don't know the laws, and
Oh
I
my
try to
gosh.
educate them.
Yes.
And the thing is with her, you know, I went to a restaurant and I had her contained. And they said, well, she's barking at the. You don't have a disability. You need to leave because your dog's barking. And I'm like, excuse me. And then, but people don't realize that a psychiatric service dog is for PTSD.
Yep.
The only thing they need to do is alert you,
Yep.
to
Yep.
bark and alert you.
A big problem with PTSD and that. Like, I mean, I would say even in the last maybe 5 years,
Check my flowers.
it's just now hitting us. Like before, it was deal with it. Like, you know.
Do you know what I did? Do you know the reason I'm disabled
No, it's boyfriend.
is because.
He messed
Can
up
you come
last
this
night.
way just a little bit? I can't turn my head.
Oh yeah.
I had to. I'm sorry.
Because,
I back in 2018, I discovered in Tuscaloosa, Alabama, at the VA. I worked there 10 years as a
I
nurse.
could never tell you were from Alabama, by the way.
I discovered that veterans were dying,
Yeah.
not getting their care in the community, just like in Phoenix. I think and that they were embezzling the funds that they were supposed to be paying the providers. I was sitting there after they mobbed me that day to shut me up, which is not going to do any good. I will still not be silent. When I was sitting at my desk that night at 6 o'clock, somebody walked in behind me and broke my neck for me. I picked my head up off the, I guess they thought I was dead. I picked my head up off the desk, threw up in the garbage can, and continued to work till midnight, and went home, and I never worked again. And since that time, they have continually, so it's been one thing after another that people have been doing to me to shut me up, and it's not gonna work.
Yeah.
So,
People don't understand, you know, all in all, as a mental health issue, it's fairly new. I mean, really, it's been there, always, but recognizing it, very, very new in any type of field, you know. It's just, in something like that, those...
you're a veteran, right?
You know.
You're a veteran?
Yeah.
Well, people don't understand right now that the jihad, and it's not talked about, but they have decided to, it's very ingenious to come in and kill veterans from the inside their hospitals. That's what they're doing. And people don't believe that because they don't think that people would do that. But, yeah, just not letting them have their care, that's all they had to do. Don't let them have their care and they die or have adverse events that causes them to die. So, and then they're embezzling the money or laundering the money somewhere else. Yeah, and it's still, it covered up for 2 years, shoved it, and then in December, I wrote out a testimony of everything that's been done to me and sent it in, and they've started again. But the thing is, it's still not out there. People still don't know about it. It's sad.
There's no doubt about that. It's insane. Time, like more time, it all comes out, you know?
Right now, you know what I'm asking for? I came in here because I'm having a hard time. I need my medical records and an MRI, a disc. It would take 10 minutes. And they're giving me a hard time because they don't want to give me the records. So, that's what I'm dealing with right now. All I have to do is go in there and pull the records out.
It's all over the place, man.
I'll walk with you. Here, I'll walk with you.
It's insane.
I don't think anybody's gonna run off with your truck.
You would, nowadays, you would be very surprised.
It's okay. He's not getting too close.
Is it happy hour yet?
Somewhere.
Like I said, protect my flowers. Is it happy hour yet? Says a happy hour yet? No, it's a fuzzy navel. It's a dream. Jeez.
I'm sure there's somebody in nursing administration. It's 3:20. Nursing administration could override everything, especially the director of nursing. Is nobody here?
Out of my realm.
Okay.
Out of my realm. I'm here for one thing and one thing only. Hopefully that thing never happens, but...
Even if you have to.
Yep. Hopefully that thing never happens here, but you just never know.
You just get me here.
He's out there.
Cool air.
Yes, 'cause it's
Go
hot.
over
It is. Yeah, why do you get so hot? You just freezing. I've never had anything, you know, and I still have that little triangle shaped disc now on a fracture field. But it actually is bad as it sounds, it has. Cause I could be just walking along and take a step.
Yeah,
It'd
that's
be
all
out
it
for
takes.
2 weeks.
Yeah.
Same with mine, I had my foot down. It was on every about
Is the right way?
5 years
Yes,
later.
ma'am.
Okay, thank you.
Yes, ma'am.
5 years later. It's weird, and it wasn't no diet change or anything.
A lot of John would call to get migraine contributed to,
Excuse me, please, but may I have a patient advocate, please?
The nursing supervisor is working on that for you.
I hope so, because I'm sitting, my neck is swelling more and more as I'm sitting here.
I understand. She is God. We cannot go above or beyond her.
What's her name?
Jane,
Jane what?
I don't know what her last name is, and that's being honest with you.
Mm,
She said she'd be back now, she will.
okay.
Hi,
Hey,
you can walk to medical records.
I cannot go to medical records. I need somebody to bring them here because I have a disability. I cannot walk all over the
We'll get you a
hospital.
wheelchair.
Oh, that'll be fine.
How
Thank
did
you.
you get in here?
I walked in and it took a while for me to get in here. It really did.
Okay.
I've got all the disability things that you can see right here if you want to.
That's fine, I believe you. Let me see if I can get you a wheelchair and a
But if I expend all of my, if I go all over the place and run all over the place and have to sit because, like I said, my neck is so swollen now, I need to get my records and go back and lay down. Okay, thank you.
You have to personally go out and sign.
That's fine. Just whatever you can do to accommodate me, I really appreciate it.
But that's, yeah, that's only twice.
It's not disabling like those migraines, man, I
I
can't.
could light,
Yeah,
be in
like,
the dark room.
my nausea, all that stuff, yeah, migraines are.
Yeah, they had me on them for like 5 years.
I was taking 200 milligrams, so I take 200 at first onset, and then 100 every hour. And it would knock, man, it would knock.
I thought you said medical records was in another area.
Yeah, but we can connect, no problem.
I would rather somebody just bring me the records if they could.
We can't do that.
Why?
You have to sign.
I will sign them here.
What's the problem with all?
I just don't feel good about going anywhere in this hospital. And I really don't. And I'm just requesting somebody, I'll sign the HIPAA, y'all get them, bring them to me, please. Let me just sit here, I really don't feel good. I really don't want to ride all over the place. Please.
All I'm taking you is up to an office.
Well, I'll sign the HIPAA here, just bring me whatever I need, and I'll sit right here, please. I requested it in the beginning. I mean, I'm not trying to be ugly. I just don't feel good.
Friday's my last day. This is day 3, 2, 1.
You were doing stuff in the bank and stuff like that.
Yeah,
I see you guys in my store, my bank.
yeah, I do the Merlot one. That's the one I do all the time.
That's nice out there. It's fine. I remember when all that was vegetable field.
We had that shooting at serial killer out there. And back then, we had great backstop. There was nothing there but cows and stuff in the background.
Yep. Yeah, that one pastor's still there on the right.
He wants mom, like,
That's why it's still sitting there.
but he's gonna get it. If he don't, and he doesn't get himself.
All out of all those farmers and people over there, he's the smartest one.
Yes, he is.
Cause I knew some people, well, I knew the granddaughter of some people right there where the, little school is, in elementary.
Yeah, yeah.
I think they owned that right down from it, and had a big red barn out here, and they sold it for like $1,000, 20-some years ago, 25, 30. And now it's worth really.
Yep. Yeah, he has a price tag. And I know Walmart, Target who approached him. And they both said, well, we're not gonna give that. I said, okay, come back to me in a couple of years then. That's right.
I still got my cows out there, I ain't losing
I'm not
nothing.
losing anything. I own the property free and clear.
And it's the same with the one out there on 16 that's got
Mhm.
that little Ford-like thing.
Yep.
And you come up with the money, it's yours, but it's not, it ain't hurting nothing sitting there.
went to the other hospital yesterday in Palm Coast, and I had my medical records just like that. They went and got them. I signed HIPAA. They went and got them and brought them straight back to me. Just like that. No questions asked.
Ma'am, what was your name again?
Kimberly A. Parker. Let me give you my license.
No, I don't need your license.
You don't need my license.
No, what's your last name again?
Parker, Parker. Yes.
Oh, and your date of birth?
7865. So you're gonna give me records without looking at my license?
The woman from medical records is coming down. She's being very
Okay.
nice. She's going
Thank
to
you.
come down.
Thank you so much.
She wanted this information before she comes down.
And I need the MRI when she comes.
does that.
Thank you.
He's over the other way. He said these doors were locked.
I want all records, nursing notes, doctor's notes, everything.
She's also requesting a copy of her MRI for radiology.
Ma'am, nursing notes, doctor's notes too. I want everything.
You want it or what?
I want it on a disc so I can look at it myself.
She wants it on a disc so she can look at it.
And I want all doctor's notes, nurses' notes, everything they have.
That's in the chart.
Thank you.
Okay? Are you taking this with you to Alabama, is that what you?
Yes.
Yeah, she's going to Alabama, and she's probably gonna be seeing someone there if she wants to take it.
I'm gathering all my records and going.
Okay, Helen? Thank you. Bye.
Thank you, ma'am. I appreciate
You're
it.
welcome. She should be down shortly.
Thank you.
It may take a little bit to get the disc made.
That's fine.
Okay,
I understand. Thank you.
okay, bye-bye.
Hi, I'm just waiting for my husband to come out. I asked her, she said I'd be coming here to go to the restroom, is that okay?
Yeah, halfway down on the right.
Okay, thanks.
Look.
He needs to go to the OB farm. Just
Good.
finish right there, you're good?
And are those out there still working or no?
Are you going to see a doctor?
No,
or you have-
she's going up there for issues. I don't like to say people's issues out loud. She's going up there to see they called her to come in, they need her to come Yes, they know she's coming.
I don't think there should be any pads, as far as I know.
No, she's asking about the elevators, if the ones in the lobby are working.
The ones on this side of the lobby are not, but you go through that double door like you're going into Fusion, the back side of that elevator is working.
Okay.
You just go through the metal
ones on
double
the
doors.
side, they go to the same place. I'll go through.
Oh,
Yeah, that's the long way. She might get confused.
Oh, maybe, yeah.
Is there a place where I can sit outside and get some air? Does it have a place right? Okay, I'm gonna sit right out
There's a
there.
bench out there.
Thank you so much.
You're very welcome.
I'll come back in when she comes in. I just need some air. Thank you very much.
I'm sorry for all the.
I've just had a really hard time with people since I've been here, and I need what I need, and people have been very ugly. I'll never return back to Florida, that's for sure. What are you so nervous about? Are y'all standing on purpose? Oh, hey. Yeah, I just needed some air. Hold on, let me put her in before she bites me.
All your information will go here. You're gonna, if you're releasing it to yourself or you're releasing it to a doctor.
Like myself, I'm taking it up now.
Okay, so due to the nature of the records, I'm gonna have to get the doctor's approval to release them directly to you.
No, I need to take my records today. I'm requesting my records today. I'm a disabled person. I have asked for it several times, and no one is doing this. But I can have my records because I know the law. So I asked for my
You
records.
can get your records, I just have to get the doctor's approval.
Well, I have a hard time writing because that's what I've tried to tell them. I cannot do these things. I will sign it. Y'all gonna have to put everything else in. I'm having a hard time. And if you didn't see my disability papers, I will show them to you.
What's your date of birth?
1765.
I see your ID.
This is one of my bad things.
What is your current address?
It's P.O. Box 553. St. Augustine. 32085. P.O. Box 553. St. Augustine 32085.
It's a good phone number for you.
904-460-7417.
You want to release it to yourself.
Yes, ma'am. I want my record, please. And I want the MRI on film so I can, on disc so I can look at it myself.
So they're closed. They close at 1 o'clock.
Somebody can pull it out of there because they have x-ray techs that can do that. I asked for this yesterday and today, but I've got to have that disc to take it back with me. But I'm requesting both right now, please.
Did you,
No, I
who
have.
did you speak to yesterday?
I came in here yesterday afternoon and spoke to the security office, and they told me to come back today. I'm having a hard time. I am ADA. I know the laws. I'm requesting accommodation, and that's what I've been here over an hour requesting all this. And I've got one run around after the other. I'm asking, all they have is one there, anybody, any tech can pull a disc.
There's nobody there that can do that.
So, who's doing your MRI? No, I want it today, please.
It's not gonna happen.
Yes, it will, because I asked for it, and the nursing supervisor said I would have it. No, I asked for the disc, and she said I would have it. She said that you have to get it made, it takes a few minutes, and you have to get it made, and you'll be down with it. My record and that, she called me. And now you're coming down here telling me that you don't have anything. So, I don't know who's trying to keep me from my records, but they need to go ahead and get my records. I will see them if they don't get them. Ma'am, the nursing, right, please send the nursing supervisor back to the place.
So,
The nursing supervisor said that you would be, it'd take you a few minutes to get the disc and the records, and you'd come down, I'd sign this, and you'd hand me the records. That's what she said.
so the security guard told you wrong.
Ma'am, I know what this nursing supervisor said, and
Right, because she talked to me, and I was gonna come down here and explain to you. I didn't tell her that they were closed. Because
I'm telling you that there's an MRI person here that can do that.
no one's here. I don't know if the imaging center could do it, and I don't
Well,
know.
please find out.
Because that's out front.
Please find out, please.
But what
I'm
gonna have to
requesting you
send
as an
your
ADA.
information to your doctor.
No,
It's not gonna happen today, ma'am. This isn't due to the nature of your records.
Are
So
you
I can
telling me I
call
cannot
you.
have my records? It has to be signed by a doctor
I'm telling you today, he has to approve the release. to you.
because it's my records. My records, I have to have a release from the doctor. Or is that what you're telling
The
me?
nature of your records, some of the information has to be approved.
No, it does
before
not.
he can release it
No,
to
it does
you
not.
For the state of Florida.
No, it does not. I know the laws.
So,
Okay, so
I
you're
can
telling...
get your request started and we will call you once it's ready to be picked up, or we can mail it to you.
No, I want my records today, please. Whatever you can give me today, give it to me today.
And now, regarding the images,
Regarding the images, go ahead and give me the report, and I will get the images later. Because actually, I think you should go ahead and give me the images today.
well, nobody's here.
Yes, they
So-
are.
So,
So you're
I
telling
can
me there's
have them
nobody to do
call
an MRI
you.
today?
Right. So I can have them call you when it's ready. They close at 1. So you can
So
pick
if
it up,
somebody came in here tonight
or
needed
they
an
can
MRI,
mail
they
it
couldn't
to
do
you.
it?
They can mail it
Are
to
you telling me if somebody came in here tonight and needed emergency MRI, they couldn't do it?
The people that produce them for the patients are not here. They closed at 1 o'clock.
So they cannot run
There's
an MRI?
limited staff going on right now.
Okay, so you're telling me I can't have any of my records after I've asked for them for 2 days in a row?
We gave you misinformation and I apologize. So I can give you test results and I can keep a
I won't,
copy.
no, you will bring me all of my records, including the imaging, please. I am requesting
The
it today.
imaging will have to get mailed or I'll call you. So if you want me to go print the results, I can
No, I
get
don't want the results, I want the imaging today.
I'll get you the report.
Somebody needs to come in and get me and run one. Somebody's here to be able to produce that.
Nobody's here. You can try the